Well, my friends, here we are. The world's attention is riveted on a new viral pandemic, and everyone is struggling to figure out what this is and what to do about it. New information appears daily. It can be hard to keep up with it and to sift out what's true from what's false. One thing we do know, each of us is responsible like never before, not only for our own health, but the health of our loved ones and community. And we've also become responsible for the well-being of our doctors, nurses, and other healthcare providers. Time seems to be of the essence, so that means we all need to get up to speed quickly. Panic sets in when we feel helpless. The solution to panic is becoming empowered to take action in a pragmatic and effective way. The Ultimate Herbal Database is your toolkit, and in this series of videos, I'm going to walk you through it and show you how you can successfully navigate through the unknown. When you log into the database, this is your opening screen, so be sure to go through the How to Use section. These little icons here where it says be sure to check the various menus, you see there's a little icon. If you click on that, it's going to take you to the menu. So those just indicate that it's either a link to something inside the database, or it may take you to an article or a video or something like that outside of the database. So I'm going to use the scroll bar and just go down a little ways here to show you these arrows. Those open and close this information panel, and I'll demonstrate that in a minute. This right pointing arrow is going to open it all the way, and this one's going to close it back up. So let's take a look at what happens when we do that. They're right down here at the bottom of the screen. I'm clicking on it to open it all the way, and then I will again click on the left pointing arrow to close it, and I can close it again if I want to see all of the different topics. Now you see there's color coding here, and to learn about the color codes you can just click on this, and but we're not going to do that now. Where you're going to go probably right off is up here to this pinned topic. Alright, so in the middle of the screen we see our main topic, which is the virus, the viral infection. And all around it you see related topics. At the top we've got the tag, which is viral infections, and that's this color. Anything this color is a viral infection. And we've got infectious disease emergencies. It's green because it's related to either a condition or a therapy. We've got pandemics, if you want to learn about those. That's connected, if you follow the lines over here, to the Spanish flu, general pandemic information, and this viral infections tag is over here related to MERS and SARS and the PrEP Act. So let's go over here and take a look at some of the other things we're going to be covering. Now, we know that it enters the body through the ACE2 receptor. If you don't know what that is and want to learn about it, you can click on that one. There are some other entry routes that we've learned about recently. I'll get into that later. For especially younger people that have strong immune systems, one of the huge complications is the cytokine storm. And you see here, and of course if I open the screen up you'll be able to read about it. Underneath are some of the things that we know help with dealing with a cytokine storm and some related issues. Now this pink color is about anatomy, biochemistry, and physiology. So we've got other things like the cytokine cascade inhibitors. This is a condition, cytokine release syndrome. And you can learn about how vitamin C helps with that, curcumin, echinacea, and bical skullcap, and some of the conditions that our big cytokine storm brewers are Ebola and then, of course, our Wuhan. So we can go back to this. There's been a lot of talk about the effects of 5G, and this heading is all about that. Looking down below, this is the main category, and these are subcategories under this main category. This blue color always relates to diagnosis. What about prevention? Let's just click on that real quick. In an upcoming video, we're going to take a deep dive into prevention. For this introductory video, I just want to show you a few of the relevant topics. So we've got immunomodulating herbs, phytochemicals. This purple color relates to a phytochemical. This color is about a supplement. This reddish color is an herb, but it's a kind of a stronger herb you have to be careful with. Laughter is immunomodulating. That color has to do with healing therapies. This color is about herbs that you can find in the wild. Let's just click on one just to give you an example. A lot of folks know about astragalus. That's immunomodulating. It's something that we take when we're not sick because it's very strong and it can push the immune system a little bit too far, especially when you're worried about something like a cytokine storm. So up above, these are all related to astragalus. For example, its taste is sweet. It's important when you're considering the use of an herb for this virus or anything else that you check out cautions. Also know about preparations and dose. Here you see there are instructions for growing this herb. I'm opening up the info panel just to give you an idea of the type of information that's in here. At the top, we have some videos, studies, a Wikipedia article. You can see the listing on Duke's database by clicking on that link, and some articles, how it helps with the heart, boosts stem cells, enriches the blood. This is pertinent. What is it doing to the immune system? Well, it's increasing expression of interleukin 2, 4, 6, and 10. Those are all in the database. If you don't know what they are, you can look them up. It promotes cell growth, enhances anti-flu activity. It enhances the CD4 helper cells and the natural killer cells. Improves lymphocyte count. Helps with cardiac function. Here's some about how it's traditionally used by the Chinese. These are indications that have been supported by clinical trials, such as impaired immunity, especially if associated with leukopenia, that's low white blood cell count, could be a result of cancer treatment, viral infections, including the common cold, so on and so forth. Helps with mental depression, reduces herpes incidence. Here's how it works with cancer. Here's some studies that you could read. Liver fibrosis. Okay, just to kind of give you a little flavor. Now we're going to go back to prevention. The botanical neuraminidase inhibitors could play a role. Sleep is huge, and if you have sleep problems, it's time to get to work on that because our immune system is doing its work while we're sleeping. So we do need to sleep. Here are sleep aids, for example. And I'm just going to click on that. Look at all those. And up here, of course, we see where it's important. Convalescence, chronic fatigue syndrome. Let's go back here. And I'm clicking back on prevention. Anti-inflammatory foods. This is the color of foods and nutrition. Here are some top anti-inflammatory foods. Other areas you're going to want to look at, and we will in future videos, are the hand sanitizers. How do you make your own, especially ones that actually work? What about immune support for viral pneumonia? Mental health first aid, that's a big one. So is stress reduction. You can use a neti pot for nasal irrigation. Why do Brazil nuts help prevent this virus? And what about chaga? Of course, face masks, how to use them, how to make them if you can't buy them. What about nanosilver? Alkaline structured nanosilver, not the same as colloidal silver. And we'll zero in on prevention for children. So that's the prevention area. Again, like I said, we will dig into that. As for treatment, this area is very controversial because we just don't know for sure. At this point, everybody agrees there is no known treatment for this particular virus. However, progress is being made by the medical scientists. There's some promising medicines on the horizon, and there are reasons why we could be looking at certain herbs, and this is where you will dig into that. Now, this is very relevant if a situation comes up where someone is sick with this when the hospitals have become overrun and there just isn't any treatment available through the medical system, and somebody winds up having to stay at home. And this is something that we don't want to see, but if we do, we need to have a few tools available to us to help improve the situations. We'll get into this too now. So a few other areas, we want to get into the economic effects. I think a lot of folks are feeling that now. Also geopolitical. This area is updated regularly, as is all of this. The effects of 5G specifically on this virus. What about information control? That's been a problem all along, getting good, accurate information. And here you can find out what's being done about that. Drugs and medical supplies made in China and India. Huge. There is a problem with the supply chain. There are certain drugs that we need here that are made in China and India, and they are either not being sent to us deliberately. For example, China is threatening to withhold all of that, and India has said they are needing it for their own people. So this section I keep updated as information comes out. Information specific to children. No toilet paper, no problem. Click on that and find out what to do. Here we get into quarantine. What are the prospects there? How do we deal with quarantine? What kind of news is coming out about it? Then, of course, recovery. This area, reports from China, citizen journalists, has become kind of a historical archive because a lot of that information is not coming out anymore. China's clamped down on them. But when it was raging, there were Chinese citizen journalists getting videos out through their VPNs, and those are in here that document some of the craziness that was happening there, and I think it's worth viewing. Alerts and news. This is very dynamic. Every day it's changing. I'm taking out certain things that are no longer news and adding new things, so you might want to keep up with everything showing up here. What are the origins? Here we explore that. It is through the scientific mind of scientists in this country and China. What about our pets? And then we've got studies here. So with that, I'm going to close this introduction. Next time when we come back, we're going to open up this main category and talk about the illness itself. What is it? What are the symptoms? What's the pathology? Subscribe if you want to keep up with this series. Subscribe to the Ozark Herbal Academy YouTube channel. And of course, take advantage of the database right now. I'm going to try to get all this out as quickly as possible, but it tends to take me a long time to get videos together to my satisfaction and publish, but I am going to do that. I've been working on this for months, and I think it is in good shape now and ready for you guys. So thanks for watching. Please share this. We want to help everybody get through this and move on to, I don't know if it's going to be life as normal, but it's going to be life as the new normal, which we would like to see be an improvement